Hello again. In this lecture today we're going to talk about the technological implementation of the NeuroVision technology, or in other words, how the NeuroVision scientific principles are made into a product. The NeuroVision technology comprises of a series of computer interactive treatment sessions, which means that actually the way we train the brain to see better is through computer interactive sessions. The treatment itself is delivered through the internet to workstations that can be actually placed anywhere. It can be at a medical center, at an ophthalmic or optometry clinic, or even at the patient's home. Just any normal PC will do. The treatment is personalized. It's tailored to each individual unique needs. That's a very fundamental issue with regards to NeuroVision. It's not that everybody receives exactly the same treatment. Every individual is getting a personally tailored treatment session that is unique to their visual needs and unique to their progress within the NeuroVision treatments. The technology itself is formed about proprietary and unique algorithms that actually tailor the exact treatment to each individual patient. The whole core of the system are these algorithms that actually decide what kind of stimulus the patient need to be exposed to in order to achieve the improvement in vision. So the patients, the subjects, are presented with a series of visual stimulations that are using the Gabor patches that we have seen in the previous lecture, with the following parameters that are dynamically controlled. That's the way they will see it on the screen. It can be different number of Gabor patches on the screen. They can be differently arranged on the screen. The orientation, they can be vertical, they can be horizontal. There can be different global orientations or local orientations of these Gabors. The spatial frequency, or in other words, the size of the Gabor patch, it can be very large or very small. It can be in high contrast. It can be in low contrast. The exposure duration itself may be very long or may be very short and brief. And here you can see some examples to these Gabor patch arrangements. You can see they can appear in different contrasts, different sizes, different orientations, different arrangements, and so on. Let's see an example. What does a patient exactly need to see when they're sitting in front of the computer? So they will see two displays that will capture the entire size of the screen. As you can see here, the first display and the second display. Each display will be displayed briefly with some interval between them. And we ask the patient to say whether the first or the second display had a Gabor patch in the center of the display, or in other words, which of the displays had 3 Gabor patches. In this example, it's very obvious that the first display is the one with the 3 Gabor patches. If the first display is the correct one, we ask the patient to click on the left button of the mouse. If the second display is the correct one, we ask the patient to click the right button of the mouse. They must make a choice. There is no I don't know button. Once they make their choice, they will get an audio feedback which will beep in case they made an incorrect response. This task is repeated, and it becomes more and more difficult as the patient gives correct answers, or the opposite. It will get easier as the patient gives incorrect answers. That task will end once the system actually determines the patient's threshold level, which is what contrast level is the threshold that below that they aren't able to tell which one is right and which one is wrong. In that case, we saw just a specific treatment session. Now, if you look at the entire treatment flow, the whole treatment starts with a baseline examination that actually fills 2 purposes. First, to make sure that the patient actually meets the inclusion criteria for the specific product, and second, to write down the baseline quality of vision and visual functions before the treatment. Once all that is done and the data is entered into our system, the the computerized treatment sessions will start. It starts with computerized analysis of those neural inefficiencies. That would be the first 2 treatment sessions, in which the system will decide exactly what should be the treatment path and the treatment paradigm for this specific patient. And then it will continue with a set of approximately 30 treatment sessions. It can be less for some products, it can be some more for others, but in average I can say it's about approximately 30 treatment sessions. Each session lasts about 30 minutes, and they should do approximately 3 sessions a week. That can be done, as I said before, at home or at the clinic. Every time that they finish their treatment session, the results or the thresholds detected at that treatment are sent over the internet automatically into our data center, where the algorithms will work on that and will create the next treatment parameters to that specific patient, and that information will be downloaded to the patient's PC at home or at the clinic. In addition, every few treatment sessions they will go and visit back an optometrist who will do a very simple visual acuity and contrast sensitivity test in order to monitor the progress also in visual functions, not only the computerized progress in the treatment. At the end of it, which I said approximately after 30 treatment sessions, the patient's vision does not improve any further, and then the treatment is completed. In a more technical layer, just to go briefly over that, we have a data center which is hosted at a well-controlled facility which stores the patient database of all the patients that we have worldwide. It contains the expert system that runs the algorithms, and also the admin application that runs all the data entry for all the specific patients. Over the internet from the clinic, actually, any computer with a standard internet browser can be an administrative workstation, which means the clinic staff can log into the system, see the patients, see their progress, key in their visual functions into the system. All the data entry and data retrieval is done through any standard PC with a browser. No need to install any special software. Just go into the right web page with a username and password, and you can access your patients. The treatment application itself needs to be installed on the treatment workstation. It can be a computer at the clinic, it can be the patient's own PC at home. Once installed, it will automatically download the treatment parameters for the next treatment. It will be stored locally on the patient's computer. Once they're ready, they can do their treatments. The treatment results are also stored locally and automatically transmitted over the internet back to our data center, where it will be analyzed, and the treatment parameters for the next treatment session will be created. This is our last slide regarding the treatment, the NeuroVision technology implementation. Thank you very much.